Medical nanotechnology, revolutionizing liver disease treatment. Welcome students. Today, we dive into the world of medical nanotechnology, a cutting-edge field that holds immense promise for the treatment of liver diseases. In this comprehensive lecture, we will explore various topics related to liver-specific drug delivery, mechanisms of passive targeting, controlled drug release, intracellular delivery strategies, pharmacokinetics, liver clearance mechanisms, surface modifications, tumor-specific targeting, liver fibrosis treatment, biodistribution studies, immunological responses, and the challenges in clinical translation. Let's embark on this enlightening journey together. Nanoparticles, at the forefront of medical nanotechnology, offer immense potential for liver-specific drug delivery. Through the process of ligand conjugation, these nanoparticles can be functionalized with specific molecules that enhance their targeting efficiency towards liver cells. One such example is the utilization of Asialoglycoprotein receptors, highly expressed on the surface of hepatocytes, to enable the selective accumulation of nanoparticles in the liver. This ligand-mediated approach ensures enhanced drug efficacy and minimized side effects. Moreover, we will discuss the various techniques employed for the successful conjugation of ligands to nanoparticles, including surface modification and bioconjugation chemistry. Passive targeting relies on the unique physiological characteristics of the liver, known as the enhanced permeability and retention (EPR) effect. During liver disease progression, blood vessels within the liver become leaky, allowing for the accumulation of nanocarriers in diseased regions. We will delve into the mysteries of this intriguing phenomenon, exploring the factors influencing passive targeting, such as nanoparticle size, surface charge, and hydrophilicity. Additionally, the role of liver-specific receptors, such as scavenger receptors, in nanocarrier accumulation will be discussed. Effective drug release from nanoparticles is crucial for successful liver-targeted therapy. In this section, we will examine various strategies employed to achieve controlled drug release, including stimuli-responsive systems such as pH, temperature, and enzyme-sensitive nanoparticles. Advances in nanotechnology have enabled precise control over drug release kinetics, ensuring optimal therapeutic concentrations at the target site. We will also discuss the challenges associated with achieving sustained drug release while maintaining stability and drug integrity. To combat intracellular targets in liver diseases, innovative intracellular drug delivery strategies have emerged. We will explore the utilization of nanocarriers to deliver therapeutic agents directly into the cytoplasm or specific organelles of liver cells. Techniques such as endosomal escape, subcellular targeting, and cell-penetrating peptides will be discussed. Moreover, the design considerations in achieving efficient intracellular drug delivery, including nanoparticle size, surface charge, and cargo stability, will be highlighted. Understanding the pharmacokinetics of liver-targeted nanoparticles is essential for optimizing their therapeutic efficacy. We will delve into the absorption, distribution, metabolism, and excretion (ADME) properties of nanomedicines, focusing on their liver-specific kinetics. Factors influencing nanoparticle circulation time, biodistribution, and drug release will be thoroughly examined, unraveling the complexities associated with nanocarrier behavior in vivo. In addition, the importance of preclinical and clinical pharmacokinetic studies in predicting nanoparticle behavior in patients will be emphasized. The liver plays a crucial role in the clearance of nanoparticles from the bloodstream. In this section, we will explore the mechanisms underlying nanoparticle clearance from the liver, including uptake by Kupffer cells, hepatocyte uptake, and biliary excretion. The interplay between nanoparticle physicochemical properties and clearance mechanisms will be elucidated, shedding light on the factors governing the fate of nanomedicines within the liver. Furthermore, strategies to mitigate rapid clearance and prolong nanoparticle circulation time will be discussed. Surface modifications of nanoscale drug carriers have emerged as a powerful tool to enhance their liver accumulation. We will explore the use of stealth coatings, such as polyethylene glycol, PEG, to prolong circulation time and reduce undesired interactions with the immune system. Additionally, strategies to actively target liver cells using ligand-mediated approaches will be examined. Surface engineering techniques, including surface charge modulation, polymer grafting, and biomimetic coatings, will be discussed in depth, highlighting their impact on liver accumulation and therapeutic outcomes. Liver cancer remains a significant health burden worldwide, and nanotechnology offers tremendous potential for its targeted treatment. We will delve into the recent advancements in tumor-specific nanoparticles targeting liver cancers, including strategies based on tumor-associated antigens, antibodies, and aptamers. The selective accumulation and enhanced therapeutic outcomes achieved through active targeting will be explored. Furthermore, the challenges associated with tumor heterogeneity, drug resistance, and clinical translation will be addressed. Liver fibrosis, a hallmark of chronic liver diseases, presents a major therapeutic challenge. Nanotechnology-based approaches show promise in addressing this unmet medical need. We will discuss the advancements in nanomedicine for liver fibrosis treatment, including the use of antifibrotic agents, gene therapy, and regenerative medicine. Additionally, we will examine the potential of targeted drug delivery systems in modulating fibrotic pathways and promoting tissue regeneration. Accurate assessment of nanomedicine biodistribution is critical for their successful clinical translation. In this section, we will explore the techniques employed to study nanomedicine biodistribution in preclinical and clinical settings. Imaging modalities, including positron emission tomography, PET, magnetic resonance imaging, MRI, and fluorescence imaging, will be discussed. Furthermore, the challenges associated with quantitative and longitudinal biodistribution studies will be addressed, aiming to improve our understanding of nanomedicine behavior in vivo. Immunological responses induced by nanomedicines play a pivotal role in determining their safety, efficacy, and clinical translatability. We will delve into the interactions between nanomaterials and the immune system, including the activation of innate and adaptive immune responses. The influence of nanoparticle properties, such as size, surface charge, and composition, on immunogenicity will be thoroughly explored. Furthermore, strategies to mitigate unwanted immune reactions and promote immunomodulatory effects will be discussed. Despite the incredible progress in medical nanotechnology, several challenges hinder the clinical translation of nanomedicine for liver diseases. In this section, we will discuss the regulatory hurdles, manufacturing scalability, and toxicity concerns associated with nanomedicines. Furthermore, the complexity of disease heterogeneity, clinical trial design, and cost-effectiveness will be addressed. By understanding these challenges, we can pave the way for successful implementation of nanomedicine in clinical practice. In conclusion, medical nanotechnology represents a promising frontier in liver disease treatment. By harnessing the unique properties of nanoparticles and employing innovative strategies, we can enhance drug delivery to the liver, improve therapeutic outcomes, and mitigate adverse effects. However, several challenges lie ahead in the clinical translation of nanomedicine. Through interdisciplinary collaboration and continuous research efforts, we can overcome these barriers and unlock the full potential of medical nanotechnology in revolutionizing the management of liver diseases.